Well, hi, everybody, and a very pleasant good afternoon to you, wherever you are. That's the famous greeting that Vin Scully has welcomed us to for so many years at the start of every Dodger game. And tomorrow is opening day at Dodger Stadium. A little bit longer this year in this pandemic, later this year than when we usually start. And it's definitely a different kind of opening day. But even so, we'll get to see our boys in blue take the field, and that is something that is very special. It'll be the Dodgers versus the Giants, our greatest rivalry, and it will serve as a welcome distraction in this time when we've needed to be distracted now and again, a source of comfort during these uncomfortable and unprecedented times. I know there's a lot of excitement, I certainly feel it, about our players taking the field again. There's spots on the diamond and plenty of buzz about our team, including a new superstar in Mookie Betts, who's signed on to don Dodger blue for more than a decade. I know I'm excited, and I'm sure many of you are as well. And I'd love nothing more than to see him and the rest of our boys in blue in person. But even though we're not able to sit in the stands, do the wave, and have a Dodger dog right now, together we can rally behind this team and remember all the good times we've had at Dodger Stadium. And we can rally behind this city and remember the good times that are still awaiting us if we get the job done during this pandemic. I'd like to begin to also share some good news with you as well today. I was able to yesterday visit County USC Hospital and visit with Los Angeles Fire Department Captain Victor Aguirre and his wife, who were together, as you'll recall, 65 days ago, the vicious fire that we had downtown here at a smoke shop. A fire that injured firefighters and almost claimed Victor's life, and we thought, because of his severe burns, would claim his hands. The amazing doctors and nurses and folks at County USC went to work and showed the spirit of this city. His wife, Claudia, spent every single day in that hospital with him. And the firefighters, his brothers and sisters, brought food to him every single night, cooking from the fire station and bringing to the hospital the nourishment that he needed, while other fires went to his home, helped paint it, replaced the air conditioning, got it ready to welcome him home one day. And through his courage, Victor, and I hope you're watching this tonight, is finally at home. He told me yesterday he couldn't wait one day to get back on the job, to be able to save more lives and save more properties. He said, I was meant for this work. I've been doing it since I was a teenager, when he was an explorer, then on a fire crew. He is somebody who embodies who we are. And today, through the miracles of everybody who was praying for him, through the doctors and all the help he received, he can feel in those hands, and he's on a road to recovery. Victor, thank you for embodying the best of Los Angeles. That's what heroism looks like. But heroism doesn't have to just be somebody wearing a badge responding to a fire. It's you, every single day, answering the call of your city, to don a mask, to keep your distance, to wash your spaces and your hands, and to do the smart things that will allow us to continue to save lives in LA. You know, Victor's courage and passion is an inspiration to us all, something I've felt across our fire department every moment I've been a public servant. And these true angels in the city of angels are surrounded by all of us who have the potential to do the same. So tonight, let us catch you up a little bit on where we are in our work to protect each other in our response to the COVID-19 pandemic. The COVID threat level tonight remains at orange. We are not moving to red, and we are not closing any additional businesses or activities. And because, as I've communicated every single time, it takes 3 weeks or so to see the effect of our actions, both when we open and also when we restrict, to see where that COVID-19 needle moves. We know today's statistics are a snapshot from a couple weeks before. Between the closures 2 weeks ago and the renewed vigilance that I'm certainly feeling across the city, we'll know in the next week or so, together, guided by our county health department, by the data, where we are and where we're moving. Every day we learn more about how to defeat this coronavirus. The CDC director said just last week that if we all wore masks in America, we could have COVID-19 under control in 4 to 8 weeks. If people wear masks and stop gathering, if people wash their hands regularly and keep their physical distances, we will suppress this virus. And you see, our actions will dictate and determine our future, whether the worst is behind us or still ahead of us, if cases will surge back up or if we will once again successfully bend the curve back down. Here in Southern California, city and county and state leaders have worked closely together. We have the same public health orders, and we share the same goal: to save lives and to get LA off the state's watch list so that we can continue in our recovery journey. That means lowering disease transmission, that means reducing our hospitalization, and that means maintaining sufficient hospital capacity. That's why we hit a hard pause on our reopening and closed spaces and places where COVID-19 was spreading. As our State Health Secretary, Mark Ghaly, said, and I quote, "We will always have our finger on the reopening dimmer switch, and we are not afraid to use it if things get worse, if our hospitals see a surge, and if we risk being overwhelmed." Everyone needs to do their part to make sure that doesn't happen, including our businesses. Our business ambassadors have fully returned to operation. And while the vast majority of businesses we found are following the protocols necessary of our city and county orders as well as our state guidelines, 61 non-compliant businesses have been referred by the city attorney's office. Businesses need to follow all the rules all of the time. It's not a pick and choose menu. You can't decide which things you want to abide by and which you won't. All of them, and they're easy to find at coronavirus.lacity.org/business. From day one, I've promised that we will trust in following the science and the data that we know, to follow the guidance of medical experts, and provide you with all of the numbers that are informing our decisions. So here are the numbers you need to know for today. Today, the county reported 3,266 new infections, bringing our total to now 164,870 diagnosed positive cases. 1,133 of those cases were in the city of Los Angeles. And the county also sadly reported 64 deaths, the third highest number since this virus has visited us here. We now have a total of 4,213 deaths in LA County, and our hearts go out to everybody mourning the death of a loved one now or at any point in this crisis. All told, we have reported more than 9,000 cases and 122 deaths in the first 3 days of this week. Let me put the danger of COVID-19 right now in perspective. As of today, COVID-19 is on track to become the second leading cause of death in LA County after coronary heart disease, and obviously the only one that can be spread by transmission. The leading causes of death from heart disease to cancer rarely change, so this is a significant development. Our hospitalizations now stand at 2,210, down slightly from the peak of 2,232, but still also our third highest hospitalization level ever recorded. And across the county, there are 620 beds available, 516 of them in acute care and 104 of them in the ICU, as well as an inventory of 1,116 available ventilators. We have 623 ICU patients who are severely sick with COVID-19. This is a 51.2% increase in the last month. And young people, as I remind everybody, each one of these briefings, are not immune to COVID-19. They can contract it, they can die from it, and they absolutely can and are spreading it. The numbers make it clear. 8.7% of all those infected in California are younger than 18 years of age. And in Los Angeles, where we just had 30% of the cases about a few weeks ago among folks 40 and younger, it is now a staggering 57% of the caseload among folks who are 40 and younger. And more than 12,000 young people have tested positive, many of whom have become very ill and hospitalized. To the youngest Angelenos, Californians, Americans, please do not gather with others. if you are reckless, if you get infected, and while you might have mild symptoms or none at all, when you spread this lethal virus to a family member, it can kill them. So be smart, don't gather, and please wear a mask. We need to assume that COVID-19 is everywhere right now. We need to be vigilant. The county, though, in good news now estimates that our collective work in this last 10 days has helped us drive the transmission rate down. Remember, it was as high as 1.17 in recent weeks, last week at 1.06, and it's estimated today to be at 0.94, below that magical threshold of 1, meaning that every person who's contracting COVID-19 is now estimated to be passing that on to less than one person, but only if we keep up this work. Don't let down your guard. Don't assume that that's an invitation to now go out and to relax. Keep up the work that you are doing. We are seeing some good numbers. When it comes to this crucial number, our daily actions matter. The level of COVID-19 transmission gets better or worse based on what we do as individuals and collectively. So while there's good news, know how fragile this moment remains. And please, please, please don't back up to where we were just a few weeks ago. Some other good news I'd like to share with you comes from our skilled nursing facilities. As you'll recall early on, about 45% of our deaths occurred of our senior Angelenos in skilled nursing facilities in congregate living. Through our testing program, which brought strike teams into all 135 of those skilled nursing facilities in Los Angeles City, not just once, but now twice, that provided tests for those who couldn't test and mandated that everybody not only test, but inform employees and residents of those facilities when the testing would occur. Today, that's dropped down from 45% to 25% of our overall deaths, and the current rate is now 80% down from where it was at its peak. Thank you to everybody who's been a part of that work, from the heroic frontline workers who work in the skilled nursing facilities to those folks who are family members, ensuring that all of our SNFs, as they're called, are testing, as well as the strike teams and our Los Angeles Fire Department, who has done such an amazing job to help reduce those deaths. And I know in the county, similar efforts are happening outside the city of LA, and I praise the county for their good work there, too. Another data point that we track very closely, too, is the percentage of tests that come back positive. And the 7-day average of new positive tests is now at 10% positive, which is down from 13.6% just last week. Another promising sign that what you're doing is making a difference. Yesterday, at our city testing sites, the drive-up and walk-up sites that we had our first decline in our positivity rate in weeks. Every day, it's been going up 0.1%, which might seem small, but over the period of 2 or 3 weeks, that means that positivity rate has begun to surge. But finally, yesterday, it went down for the first time, and that's holding steady today. So if you think you've been exposed, or you think that you're a frontline worker that may be at risk, ask your doctor for a test, or get tested at a CVS, a community health center, or any of the city, county, and state sites that have a daily capacity now, just in the city sites alone, the drive-through and walk-up centers that we run, of 18,500 tests. That's the most we've ever offered. Our turnaround time there is 30 hours. And of course, those sites don't include the additional testing we're doing at the skilled nursing facilities, homeless shelters, and at pop-up testing sites. We understand a lot of people don't have cars to drive to a testing center. So we're sending mobile teams all around Los Angeles to offer free testing where you live. This weekend, I was out at one of them, at Trinity Recreation Center with Councilmember Curran Price in South Los Angeles in the 9th Council District. We went door to door to let people know that just a couple blocks away in the park there are free tests. And we handed out masks, and we asked people to fill out their census forms. We were today with a mobile testing team at Cesar Chavez and Soto in Boyle Heights, where we conducted more than 300 tests. And tomorrow we're sending our mobile team to Nickerson Gardens housing development. Part of our efforts to make sure we're getting tests where they need to be, and something I'm also very proud of, that remember at the beginning of this, nationwide we were seeing African-American deaths at twice the percentage of African-American population in many major cities, including here in LA County. Well, today, outside of our skilled nursing facilities for folks that don't live there, we have brought that percentage under the population percentage of African Americans in LA County. Something that shows we can save lives, we can message, we can bring racial justice, we can bring better health. Now we need to do this in our communities, especially our Native Hawaiian and Pacific Islander communities, where we're seeing the highest rates of infection and mortality of any ethnic group in Los Angeles. So go get a test. coronavirus.lacity.org/testing. So if you are an essential worker or you work in a high risk environment, if you think you might be exposed or because of your medical conditions you may be at high risk, get a test. And if your test comes back positive, you should expect to do an interview. They are brief, but can last, by the way, up to an hour with public health specialists from the county. And these contact tracers, which include LA City employees who are doing amazing work side by side their county expert colleagues. We need to know everybody you've been in close contact with and those who test positive, to have come in close contact with those who have tested positive so that we can limit community spread. This is so critical. And 3/4 of people are answering those calls, but 1/4 still we're not getting to. So spread the word that if a member of the contact tracing team reaches you, it will appear on your phone as LA Public Health, and please answer that. They'll leave a message if you don't answer, and please call back. That decision, that conversation will save lives, will help us on a recovery journey, and will ensure our economy can stay strong. These are not law enforcement agents. They will not ask about your immigration status. They won't ask for money, so if anybody is masquerading as that is a fraud. They will only ask who you had contact with so we can prevent more people from getting sick and save more lives. As I've mentioned each time too, another way we can save lives is by getting resources for health, for education, for transportation, affordable housing, everything from our fight to end homelessness to our racial equity journey right now depends on you completing the 2020 census. As I went door to door in South Los Angeles this weekend, we were able to boost those numbers up in one of the neighborhoods that had answered at the lowest percentage in LA. But our response rate still is embarrassingly low, 52.1%. Far behind California's 59% response rate and America's 62% response rate. So we need everybody to be counted. Don't give your money away to another state or another city. Go to my2020census.gov and fill out the form for everybody in your household, or send back the form that you will have received in your mail. Or if neither of those are available to you, call, and you can do this on the phone at 844-330-2020. And I want to make something clear. Any attempt to exclude immigrant families from this count is wrong, it is un-American, and it is unconstitutional. I want to reassure all Angelenos, especially immigrant Angelenos, that are unsure of what this means and concerned about participating. We need you to fill out the census form. You need to be counted. Your information is confidential. It's a federal crime for that to be shared by the census agency with any other level of federal government. And we have Census Goodwill ambassadors, everyday folks who today are canvassing and encouraging Angelenos to complete the census while providing masks and keeping people safe. So please answer the door if you hear one of those Census Goodwill ambassadors coming, and if you want to become one, we can put you to work. Please go to census.lacity.org to sign up. Last Friday, I announced, together with Councilmember Curran Price, an additional $10 million in funding for the LA Regional COVID-19 Recovery Grant Program. In simple language, business grants for our local mom and pop businesses. It's designed to address and help our most vulnerable small businesses, many of whom did not receive anything from the federal Paycheck Protection Program. And they're grants, not loans. I've heard loud and clear from so many businesses, we don't need the federal government or anybody else to give us another loan. We need a grant. And so, without incurring more debt, we launched this program to help you. And yesterday, the second of 6 rounds of grant applications, where we're putting money together with Los Angeles County, rolled forward. The response has been wonderful. More than 18,700 applications were received the first day. Nonprofits can apply, mom and pops, everyday businesses. And if you were not selected in the previous application, there will be chances ahead, chances to reapply, as I said, 4 more times. But you can go to LACOVIDfund.org to apply through the end of this week or contact one of our city's business source centers by calling 311. That massive number of applications, though, highlights something that local government will never be able to do on our own. That small businesses across America are feeling this pain, and their employees are too. We need the federal government to step up and to support these efforts, to support small businesses who are struggling, who wonder whether they will still be in existence. Today, I sent a letter to the Los Angeles congressional delegation, the Republican and the Democratic leadership, outlining what our city's top 10 requests in this critical moment of what will be the next coronavirus relief package that's being negotiated right now. And I would tell Congress, don't go on vacation until you deliver help for the American people. We've got a couple weeks to have them deliver something to the president's desk and for him to sign, to extend benefits, to make sure that unemployment continues, to have cash payments. And we're asking for funding to avoid furloughs, to keep our essential public servants on the job, on the front line against COVID-19, and to make sure that there's funding for testing and a $600 bonus for unemployment insurance. Congress needs to take action, and the president needs to sign that into law. And I look forward to getting this done with our federal partners to get this bill done as quickly as possible. In the Southland, you should be very proud. Here, we have the Republican Mayors Group led by a Southern California mayor, Aquanetta Warren, mayor of Fontana, who leads Community Leaders of America, and they've signed on to this. I'm honored to be the head of Democratic mayors, which are all the Democratic mayors across the country. And the two of us together are showing bipartisan support from across this nation, but led by two mayors from Southern California, to show Congress this isn't a partisan issue. This is an American issue. It's not red or blue, it's red, white, and blue. Remember, my friends, wearing a mask will help end this economic pain. You can save our economy by wearing a mask. You can help us reopen more businesses by wearing a mask. You can save lives and livelihoods by wearing a mask. It's about protecting, but also respecting others. This message is critically important, and we need everyone to hear it, which is why last week I shared with you the first poster in the LA Mask Print Project, an incredible visual developed by Studio Number One, founded by Shepard Fairey. And tonight we've released additional posters featuring new visuals as well as versions in Spanish. My office is already working with local small businesses to distribute these posters throughout the city. These are going to be amazing parts of our history, of our successful fight to not only knock the curve down, but to save lives and to rebuild the city. Get yourself one of these posters, especially if you're a business person. Print them out online, and you can go to coronavirus.lacity.org/maskart and display them, download them, put them in your windows, not just in your businesses, but in your homes. And let's see American and LA creativity blossom throughout this city. You can go again to coronavirus.lacity.org/maskart to get yours today. Over the coming weeks, we're going to be featuring more collaborations. We welcome your creativity to this, to reach all demographics, all ages, all geographies and zip codes. And every artist is encouraged to create a visually compelling image that incorporates a slogan or a message into their artwork promoting mask use. So find out more information how to submit at that same website, coronavirus.lacity.org/maskart. So to the artists out there, help us share this message by designing a poster. And to everyone else, help us save lives by doing your part, taking the small actions that have a big payoff for all of us. Wear a mask, wash your hands, clean those surfaces, stay home, avoid crowds, confined spaces, and close contact, and don't gather with others. And Los Angeles, as always, stay safe and stay healthy, and whenever you can, stay at home. Wishing you all strength and love. And with that, I'm happy to answer questions. Thank you. And I'll be coming back to give remarks in Spanish, as always. First question, please. Do we have any question? Can you hear me? We'll take the first one.
And the first question comes from the line of Elizabeth Choi. Please go ahead.
Hi, Liz.
Hi, it's Liz with the Daily News. So I wanted to ask you a couple questions. One is, so you've stated in the past couple of weeks that a shutdown is a very real possibility, but I haven't heard very much about what that shutdown would look like, what industries or what areas you or the county or others would be focusing in on, and what are some steps being taken right now to study and to analyze what the best route would be to shutting down.
Okay.
And also my second question is, you recently this past weekend said that you felt that the reopening happened too quickly. Nevertheless, at the time, you included in your orders the reopening measures, and I wanted to ask if you regret doing that. Did you actually agree with that at the time? And did you also, how did you feel about the county applying for the variant?
Sure.
After the criteria was loosened?
Thank you, Liz, on both the questions. Yeah, let me take the second one first. Absolutely, and I said this on Friday too, and I've said it over the weekend. I do think that we all can see in retrospect that some things did open up too quickly, that we didn't stick with the methodology of do something and wait 3 weeks and see the effect, then take the next step. It became kind of a domino effect with as I called it, irrational exuberance of everybody thinking we could rush back to normal. But that said, that's part of what this process is. I love the quote that I've been quoting from a UCLA professor who said that's how these things work. You try to open the economy, you see what happens, and then you dial it back a little bit. But I'm proud that we've done that in a way that we have been smart, we can learn, we can take a small step or two backwards, hold there, and again see what the impact is. And so far now, 7-10 days into that work, we're seeing some hopeful signs, even though this is still very fragile. And as always, of course, there's tons of regrets. I kind of think somebody was saying this is like we're seeing the science happen in real time. Remember when we were in junior high and high school, and we had the composition books, and you learn about science, you start something, and you experiment, you see what the outcome of that is, and you adjust. And then you write something else down, and you adjust. And that thing didn't work, and you go forward until you get to the answer. That's what science is. It's about trying to figure out, especially with a new threat like this, that we haven't known everything about. I don't believe, in terms of the shutdown details that could happen, and I want to be very clear, they are not imminent to happen. I shared some of the positive news since we spoke last on Friday, some of the hopeful news, and also some of the urgent need to continue that momentum, that we don't have to take a cleaver like we did before. And I know out there it feels scary. People are like, oh my God, are we going to all be completely shut down again? Well, there's not a lot actually that's open right now that was at our kind of deepest moment of shutdown, not also closed besides retail. I mean, retail would be the only thing left, but I want to be clear, there again, because I don't want to be quoted out of context, there are no imminent plans on my part, and I know on the county's part, because we have calls this morning, our leadership call with Catherine Barger, myself, Mayor Garcia and Tornick of both Long Beach and Pasadena, who have their own health authorities, and we speak every single week. There's no imminent plans to do that. If we did see exponential or double-digit growth of some of those key indicators, hospitalizations, hospital capacity, positivity rates, if we saw what we're seeing in places like Phoenix or Miami, where there's 38% positivity and 26% positivity, as opposed to about 9% here, yes, of course, we'd have to consider those things. But considering those and letting people know what that methodology is different than saying that it's happening tomorrow, which is why I wanted to open today very clearly to say we are not imposing new things, but we do need to assess about 7 to 10 days from now, which collectively will be that 2 to 3 week period. Have we had success? Can we dial back to yellow? Or if we don't have success, is it getting worse? And we'll do that every single day. Every time I communicate, we will give people plenty of runway. One of my frustrations, and I know the frustrations of people out there, is we sometimes get no notice when things change. They happen in an hour, or they happen sometimes in a day. And so that I try to give as much runway, tell people how decisions get made, share as much data as possible. And the last thing I'll say is, because we don't have to take a cleaver and kind of shut things down straight across the board. We can be much more surgical. It may be as we did in early days where we had to shut down farmers markets for a couple days, make sure that they're back on track and make them safe. It may be certain industries we're seeing outbreaks in. We reserve the right to be able to do that, but there's nothing imminent. There's nothing that we have our eyes focused on. We're looking closely at some factories where we've seen outbreak. We're talking to young people. We obviously can't shut down, nor would we shut down young people, but we're asking them to play a strong role because the spread is spreading there. And we're focused on those key populations, people who don't have access to tests, communities of color, our public housing developments, our people experiencing homelessness where the rate of positive infection is lower than people who are housed because of the good work we've done. So all of that will inform that. So again, no shutdown details. If we ever were to do that, we would give details far in advance, certainly on my part. And I think that's what we've learned from having reopened a little bit too quickly with too many pieces a month ago. But I think we're well on our way, hopefully, if this holds, to holding strong. Thanks, Liz. Next question.
And the next question comes from the line of Claudia Pashuta. Please go ahead.
Hey, Claudia.
Hey, two questions. What would you do if the Trump administration sent federal agents to Los Angeles, as we've seen in other cities? And then, do you have concerns about the Hollywood Center project proceeding, given that state geologists are saying there's strong evidence that an earthquake fault runs under the site? Thank you.
Sure. I'll take the second one first because I used to be a council member of that area. Yeah, that's something that's been there for a long time. I would just say that it has to be mitigated, and it's anything that we build in this town has to meet the seismic standards, full stop. In terms of the first piece, federal agents, it is appalling to see this. I'm close with Mayor Wheeler up in Portland. He said, violence and any protests and any things like that were actually dying down, and federal agents have done nothing but stir that up. It's frightening to see folks carrying M16s with unmarked, you don't know what agency, police uniforms, putting people into unmarked rental vans. This feels like it's something out of a science fiction dystopic series about a police state in America, but it's real. And now in Chicago, this is completely outside of their lane. It may be unconstitutional, and certainly as other mayors are looking at, whether it's Mayor Lightfoot in Chicago or Mayor Wheeler in Portland, I absolutely would support whatever legal action to make sure that federal agents who can protect federal property and things like that, those federal agents do not have domestic police powers to enforce local laws, full stop, or state laws. That's very dangerous. It's one thing if a city asks for federal help. It's another thing for federal agents to come in uninvited. And I think it's putting our police officers in a very dangerous situation too. If we don't know who people are, now anybody can dress up in fatigues. Remember, we had somebody who was dressed up as a member of the National Guard, who was not a member of the National Guard, fully armed here in downtown, who thankfully we caught because some of the patches were wrong. Think about the chaos that could be created. What our police officers have called into a chaotic situation, not knowing who's a police officer, not being able to identify, and giving no heads up to local authorities. Even when we disagree with administrations, we do have an ethic that those law enforcement agencies need to talk to each other and give each other heads up when there's major operations so that lives aren't lost. This is nothing more than politics. It's appalling. I believe it's unconstitutional. And we haven't heard anything about them coming to Los Angeles. Thank you. Next question.
And the next question comes from the line of Joel Grover from NBC4. Please go ahead.
Hey, Joel.
Yes. Hi, Mayor. I have two different questions.
Sure.
One is about small businesses and restaurants. You were just talking about the need to help them. Today, I interviewed a number of small businesses, mainly restaurants, who put up banners over their doors to let customers know they're still open. These are businesses that are struggling terribly right now to survive, as you know, and yet the city fined them $356 for posting a temporary sign without a permit. During this pandemic, shouldn't the city be giving these small businesses a break and not fining them? That's question number one. Question number two is about the homeless encampments. Some encampments seem to have doubled or tripled in size during this pandemic. Why do you think that is?
Probably a couple reasons on the second question. One is that CDC and the county health guidance is not to move people right now. so folks have less mobility. Some may have grown, but we also know that we've taken over 6,000 people off the streets just since the pandemic has begun. So I've seen other areas too where there are fewer tents, and it may be also people just moving to be with one another. But that has been the strict guidance on enforcement, given the risk to folks on the street who are often comorbid. We lost another person experiencing homelessness in his 70s that Dr. Ferrer mentioned today to COVID-19 on the streets. So we follow that advice. You're probably absolutely right that some places do increase, others have gone down. I've worked in those hotels and motels of Project Room Key where thousands of people in 6 weeks through the shelters in the city and through Project Room Key. As I said, we put about 6,000 people countywide, over 3,500 of them in the city of Los Angeles alone, into hotel rooms, where many of them are then going to work from there, because just because somebody's experiencing homelessness doesn't mean they're not working. And we're continuing to make sure, working with Judge Carter, we just made a commitment to 6,700 people temporarily housed now, getting permanently housed in the next 18 months, which will be the fastest pace on top of the 23,000 roughly that we get housed a year. Furthermore, we also have, and it's a very exciting moment, I'm glad you asked me this question, because it's gotten a little bit of coverage, but not a lot. We've been opening up a Bridge Home Shelter practically every week in the last few weeks, sometimes twice a week, with Alex Trebek, who gave, with his wife, $500,000 to open one up in Councilmember Krikorian's district, the first in the Valley in North Hollywood, the second in the Valley with Councilmember Rodriguez at an old armory in Sylmar this week. We've got 2 more on a single day in the Valley in Councilmember Buscaino's district in San Pedro, and another one coming in Wilmington. All told, 24 new Bridge Home Shelters that together with another 8 by the end of the year will give the capacity of 2,200 Angelinos being housed at any given time and rotating out from there into permanent housing. So it'll be a really big year in terms of that push. And then finally, in terms of the small businesses, I don't know the particulars of that case. I know that we have been very restrained in terms of any criminal actions or fines. And I don't know if that's city or county. I think you said it was city. But we're not only not looking just to give restaurants a break with things like LA Al Fresco, which hundreds of restaurants with an easy, no-cost permit, with our Department of Transportation setting up the bollards and helping people take parking spots and other things to set up tables. We're giving direct assistance and financial aid. And as I mentioned at the top of this, not just in loans, but now this $10 million together with $3 million earlier in direct aid to restaurants and other small businesses. And we're going to add more dollars, I promise you, to that as well. So I'm happy to follow on with you about the particular case and see if there was something, maybe multiple visits and something else. And if not, it's always my instinct, especially now, to give businesses breaks. That's why there's an eviction moratorium on tenants, commercial tenants in properties, so they don't get kicked out, the direct assistance, and the help with getting those sorts of permits for outdoor spaces, which is moving now from just restaurants to other things as well. Like I was talking to somebody right in this room who got his hair cut outdoors from a barber. So those are ways we're going to keep businesses going even in the tough times. Thanks so much, Joel. Next question, please.
And the next question comes from the line of Amy Corral with NBC Los Angeles. Please go ahead.
Hi, Amy. Are you there, Amy?
Sorry, looks like we lost Amy's line.
Okay. Any other questions?
And that was the last questioner in the queue.
Okay. We'll see if we can circle back with you, Amy. You get first question next press conference, okay? And with that, I'm going to transition to Spanish. Again, thank you, everybody. Stay strong. Root for the Dodgers tomorrow from your home. They're now on all the cable channels, thank God. That finally came through. And remember, this success is fragile. I come with you with honest numbers. I tell you the bad things that could happen because I want you to be able to be empowered to take control, and you've shown me that. In this past week, we're seeing people adhere, and those numbers are stabilizing and in some cases coming down. But they can pop up in a day or two. So let's stick with this. In this next week, let's get those numbers and this curve bent down just as we did before. Show that Los Angeles, which hasn't experienced the level of death that we've seen in other cities in America, that is not experiencing the exaggerated rise, or excuse me, the exponential rise that other cities are. We're right there in the middle, and it depends on you. So thank you, stay safe, and stay strong. I'll switch over to Spanish now. Muy buenas noches. Esta noche quisiera ponerlos al día con nuestra respuesta al COVID-19. El nivel de riesgo de COVID sigue anaranjado. No estamos avanzando al rojo gracias a sus acciones. Y no estamos cerrando ninguna actividades adicionales ni negocios. Toma cerca de 3 semanas para saber si nuestras acciones han impactado el COVID-19 en nuestra región. Con los cierres hace 2 semanas y el control renovado por toda la ciudad, vamos a saber en la semana entrante si estamos mejorando nuestros datos. Los datos de hoy. Hoy el condado nos informó de 3,266 nuevas infecciones, llegando a un total de 164,870. Y 1,133 de estos casos están en la ciudad de Los Ángeles. El condado, trágicamente, también reportó 64 fallecidos, llegando a un total de 4,213. Ahora tenemos 2,210 hospitalizaciones y en el condado hay 620 camas disponibles, incluyendo 516 de cuidados agudos y 104 camas de cuidados intensivos. Y hay 1,116 respiradores disponibles. Tenemos 623 pacientes en cuidado intensivo, quienes están muy enfermos con COVID-19. Es un aumento del 51.2% desde el mes pasado. Estos días son críticos. El 8.7% de personas infectadas en California son menores de 18 años. Por favor, para los jóvenes en California y Los Ángeles, no se reúnan con otras. El condado ahora estima que la tasa de infección está al 0.94, ha bajado del 1.06 y menos bajado del 1. Es el número mágico. Debemos mantener nuestros esfuerzos para mantener esta tasa de infección más abajo de 1 a largo plazo para poder aplanar la curva y salvar las vidas. El porcentaje de resultados de nuestras pruebas que son positivos está al 10% y el promedio de resultados positivos de 7 días es 8.5%, una reducción en comparación de la semana pasada. Si piensa que ha sido expuesto al virus, por favor, hágase la prueba. Las pruebas de detección son gratis por todos, con o sin síntomas. Para encontrar más de 100 lugares ofreciendo pruebas de detección, visita la página coronavirus.lacity.org/testing o llama al 311 si no tienes acceso al Internet. Tenemos pruebas en la comunidad también. Este fin de semana yo estuve con el concejal Curran Price en el Distrito 9 en el sur de Los Ángeles, cerca del Parque de Trinity, para pruebas gratis por la comunidad. Y hoy estuvimos en Boyle Heights, cerca de Soto y Calle Primera, por más pruebas, más de 300 gratis. Si recibes un resultado positivo, recibirás una llamada de una especialista de salud pública del condado para hacerte una breve entrevista. No son agentes de policía o de inmigración y no le van a preguntar sobre su estatus migratorio. Son aquí a proteger su vida y las vidas de su familia. Otra acción importante que les pido a todos es completar el censo 2020. Hay mucho miedo en este país ahora porque las acciones, el odio y las palabras de este presidente y esta administración, pero no tengan miedo. Es su responsabilidad y su derecho a tener una forma del censo. Ahora nuestro nivel de respuesta es 52.1%, muy detrás de la tasa de respuesta de California, la cual es 59%, y la del país, que es 62.3%. Necesitamos que todos se hagan contar. Solo necesita su teléfono o su computadora para responder en la línea en la página my2020census.gov. Además, puedes llamar el formulario que recibiste en el correo y enviarlo de regreso, o puedes completarlo por teléfono llamando al 844-330-2020. Quisiera dejar algo muy claro. Cualquier esfuerzo para excluir a las familias inmigrantes de este conteo es incorrecto, no es patriótico y es anticonstitucional. Su información es confidencial, no le preguntarán sobre su estatus migratorio, su información está protegida por la ley y no se puede compartir con nadie por ninguna razón, incluso con agencias de la policía. Para ayudar a este esfuerzo crítico, me uní con los embajadores de buena voluntad para el censo y estuve haciendo alcance para alentar a angelinos a completar el censo mientras ofrecemos mascarillas para proteger al público. Y si quieres ser un embajador de buena voluntad para el censo y unirte a este trabajo, visita la página census.lacity.org para inscribirte. Necesitamos su ayuda. El viernes pasado anuncié $10 millones adicionales para el programa para becas de recuperación regional de COVID-19 de Los Ángeles. Es un acuerdo entre el condado y la ciudad de Los Ángeles para asistir los negocios, las tiendas, la gente de Los Ángeles. Ayer lanzamos la segunda ronda de 6 para recibir solicitudes. Recibimos más de 18,700 solicitudes el primer día. Si no fuiste seleccionado en la ronda anterior, habrá más oportunidades en el futuro y les alentamos a aplicar de nuevo. La segunda ronda de solicitudes está abierta por el resto de la semana. Para aprender más y someter tu solicitud, visita lacovidfund.org o ponte en contacto con uno de nuestros centros de recursos para empresas y llámanos a 311. El llevar una mascarilla fuera de tu casa es muy, muy importante y necesitamos que todos escuchen este mensaje. La semana pasada dimos a conocer el primer cartel de LA Mask Print Project desarrollado por Studio No. 1, compañía fundada por el artista Shepard Fairey. Y esta noche damos a conocer carteles adicionales con versiones en español. Los alentamos a todos, individuos y negocios, a que descarguen e impriman estos carteles y los pongan en sus ventanas de su hogar o de su negocio. Solo tiene que visitar coronavirus.lacity.org/maskart. Los Ángeles es una capital creativa y queremos aprovechar esta creatividad para concientizar la importancia de llevar mascarillas. Si te interesa participar en esta campaña para usar arte público para el bien del público, por favor, comunícate con nuestro equipo por correo a garcetti.reply@lacity.org. Los Ángeles, quédense protegidos y quédense en buena salud. Y cuando puedan, quédense en casa. Mañana es el primer día por los Dodgers y estamos un equipo, somos una ciudad. Gracias por su liderazgo y su cariño, fuerza y amor y justicia, Los Ángeles. Buenas noches. Thanks, everybody. See you soon.